Like it or not, the senior and elderly population is vulnerable to negligence committed by medical professionals, nursing home and assisted living facilities, pharmaceutical and medical device companies, insurance companies, and everyday individuals and businesses. The Injured Senior Podcast is here to help. Steve Heisler is the creator of the National Injured Senior Law Center and has been advocating for seniors' rights for over 20 years. You have questions, and Steve Heisler has answers. This is the Injured Senior Podcast.
Hello, everyone. This is Steve Heisler, founder and CEO of the National Injured Senior Law Center, coming to you from sunny and warm Baltimore, Maryland. You are listening to the Injured Senior Podcast, and I am your humble host. And if you did not know already what the purpose of this podcast is, I am here to educate and inform the injured and disabled elderly and senior population about issues that are near and dear to them and affect them regarding those injuries. And this also applies to their families, because if you're a child or a sibling or a grandchild of an injured or disabled senior or elderly person, this is information that you're going to want to hear as well. So welcome to the podcast. Now, today we are going to talk about falls that occur mainly in senior community facilities such as nursing homes, assisted living facilities, home care settings. And I have a wonderful guest that I'm going to introduce to you in a moment. His name is Dr. Rein Tideiksaar, out of the great state of New Jersey, and he is an expert in elderly fall prevention. Now, Dr. Rein, as he is known, is the president of Fall Prevent LLC, which is a consulting company that provides educational, legal, and marketing services related to fall prevention in the elderly. Dr. Rein is a gerontologist, which is a healthcare professional who specializes in working with the elderly, and a geriatric physician's assistant. Now, Dr. Rein has been active in fall prevention for over 30 years and is the author of textbooks, professional training manuals, and director of numerous research projects regarding fall prevention. Additionally, he has developed fall prevention programs in the community, assisted living, home care, acute care, hospital, and nursing facility settings. Well, that is quite a resume, Dr. Rein. Welcome to the show. How are you?
I'm fine.
Thanks for carving out some time for us. I want to recite to you some statistics, if I can. 1 in 4 Americans age 65 plus falls each year. And by the way, this is according to the National Council on Aging. Every 11 seconds, an older adult is treated in the ER for a fall. Every 19 seconds, an older adult dies from a fall. And falls are the leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions among older adults. Dr. Rein, those numbers are sobering. Why is it that the elderly are so prone to falls?
Well, what happens as one gets older with age is that you acquire all sorts of physical and mental health problems. And those, in combination with medications that are used to treat the underlying health causes, can lead one to have difficulty with walking or difficulty with balance. So as one gets older, they become much more frail in terms of their physical and mental conditions.
Okay. And where generally are the falls occurring?
Well, when you're talking about the community, I think that the majority of falls occur indoors, And those falls occur to those individuals who are the most frail in terms of physical conditions and everything like that. And then you have a group of elderly who fall outdoors, and they tend to be much more healthy or robust, or have a lack of a lot of physical, mental problems and everything like that. And those falls are just due to poor balance and not paying attention, and trips and slips and those kinds of events. And when you get into much more of a protected population, for instance, the nursing home, those falls tend to mostly occur within the bedroom and the bathroom of the individual residents.
I was reading that in the elderly, one cause of falls is dizziness. Does that stem from being over medicated, or is that because standing up and sitting down, whatever, can alter their blood pressure? Are those some reasons why they're getting dizzy? Or
Yeah, it's a combination of all those things. I mean, dizziness, the differential diagnosis of dizziness is huge. Dizziness could be due to loss of fluids, for instance, from not drinking enough water. It can also be a loss of body fluids in terms of losing blood or something like that can lead to dizziness. Dizziness can be due to a vestibular problem that you have with the balance apparatus within the nervous system. And also dizziness could be due to low blood pressure or taking too many medications. So it's a wide variety of factors that can lead to dizziness.
And what about poor vision? Is vision issues also a big factor?
Well, yeah, poor vision is a very strong risk factor for falls, basically because if you can't see what's in front of you, you're more liable to trip or slip or something like that. And interestingly, that when you look at the injury rate of falls, is that when you get into a protected population like in a nursing home, about 10% of falls result in significant injury like a hip fracture. But there's a strong correlation between poor vision and then hip fractures as well. So not only does poor vision lead to increased incidence of falls, but also increased prevalence of injury.
Got it. So you commented that the most prevalent areas that the falls in the elderly are happening are in bathrooms and bedrooms. So that would also be the case for falls for the elderly in the assisted living facilities and the nursing homes, correct?
Yeah, basically that's correct. Although you do have, between the community, the assisted living, and then your skilled nursing facilities, you have a wide range of mobility needs for the individuals. So as you go up higher from community to assisted living to nursing facilities, and as your mobility declines, you're going to be at greater risk for falls. And when I talk about mobility, I'm really talking about the ability to walk, one's gait, and balance as well, the ability to maintain balance. All those tend to decline as one gets older and one goes up higher in terms of living situations.
So stairs are definitely a major risk factor, correct?
Well, stairs are very interesting because studies have shown that if one has stairs in the home, they actually have more muscle strength in the lower extremities because you're going up and down the steps. So in that sense, that stairs, when you're much younger in age, can be a protective factor in terms of preventing falls. But as you get older, then stairs become a real hazard.
The one thing about stairs, though, is that they have banisters, so at least they can hold on to that, I guess, right?
Yeah, banisters. And when anybody's putting handrails into their stairs, they should have them on both sides, just not one side of the stairwell.
Okay. So bathrooms. So if you're in a senior care facility, bathrooms are one of the high risk areas for seniors and elderly. First off, why is it that bathrooms is one of the top factors?
Well, bathrooms are a high factor for falls for a variety of reasons, but just to step back for one moment is that one of the strongest risk factors for falls is urinary incontinence, and that's for both men and women. And so what happens is that if you have the urge to go to the bathroom, to urinate, the ability to hold that in and get to the bathroom, that declines with age, and it definitely declines with disease. So people are generally hurrying to the bathroom. And if you're hurrying, particularly if you have underlying problems with walking and balance, that places you at increased risk for falls. Also, if you lose your urine en route from, let's say, the bed to the bathroom, you can slip in the urine as well. Now, when you get into the bathroom itself in terms of toileting, is that if you have a lack of grab bars to hold on to and you have poor mobility, decreased ability to transfer, get up and down safely, that places you at risk for falls as well. And then the other factors in terms of the bathroom is that everything in the bathroom is hard. It's all porcelain. There's nothing soft in the bathroom. So if you do fall and you hit your head, your shoulder, your hip, whatever, it's a greater risk for falls. And then, of course, the biggest problem in terms of falls is in terms of the home is the shower area, that's for sure, because porcelain is very slippery. So the best thing that you can do is to put in grab bars and everything like that. Or what I prefer for people who have poor mobility or poor balance is to use shower chairs or transfer benches there, and then extended shower hoses. So actually you can go transfer on there. You can sit within the shower area, and then you can shower as well. And that's much safer.
Yeah. So on the urinary incontinence and in an assisted living facility in a nursing home, an additional issue would be that at night when the patient is in bed and they have to get out of bed and it's at night and there could be drowsy or groggy from sleeping or whatever. Does that make it even more dangerous? Is that a reason why it's also a big problem?
Oh, absolutely. The problem, again, is you get the whole thing of individuals who have difficulty sleeping is that they're given sleep medications. And again, sleep medications make you drowsy. And then if you need to go to the bathroom, you get up and you're wobbly and your balance is insecure and everything like that. And that's an additional risk factor for sure.
So grab bars, obviously, in the bathroom, as you mentioned, are important. Is that something which is standard in nursing homes or assisted living facilities? In your experience, do all assisted living facilities have grab bars in the bathroom? Or
well, they should. They should. The problem with grab bars, and particularly when you get into assisted living or you get into nursing facility, is that they tend to be standard. That they place the grab bars at a certain height and certain angle, et cetera, but not all individuals are built the same or they have the same stature.
So it's not custom made.
That's right. It isn't that one size fits all, right? So you're going to have individuals that the grab bars may not be working properly to support their function in all cases. What I basically recommend for nursing facilities to do when a resident comes in, firstly admitted, first of all, this is a whole different new environment from them, where they came from. The whole thing's a strange world. So what I have the nurses basically do is watch the individual transfer from their beds, their chairs, and other furnishings within their room, walk around and see how they do. Are they able to do so safely? Even if they're using a walking device, either a cane or a walker. Go and walk to their bathroom. Just sit down on the toilet and observe their function. If they can do it safely, that's fine. If they can't, then you need to do some modifications to the grab bars and other furnishings within the residence environment.
And I want to make sure I heard you right. You said that the families or children or whatever of the patient should go ahead and do a walkthrough and repeat what you said.
Well, I think you've just hit on a very, very important point. Is that the nursing facility, either the nurse or the nursing aide, should do the walkthrough, but I think if the family is there, the loved one who is responsible for the care of the resident is there as well, they can absolutely see what the deficits in the person's mobility are. And so that can alert them to alert the nursing staff if those things occur within their watch.
Oh, absolutely. And that brings up the greater question, Dr. Rein. So what should be the role of the family, I guess, when you're looking or trying to prevent falls from happening in general in any type of senior care facility, or even, I guess, at home, if you're in home care? What role can the family play to increase the chances that there will not be a fall and, God forbid, a hip fracture or the like?
Yeah, I think several issues. Once a person comes into the nursing home and they're at risk for falls, let's say that the individual has some cognitive problems, that they have a little bit of depression, or they just have a little bit of mild dementia, and they also have some diseases, let's say arthritis of the knees, or they have a little bit of Parkinson's disease. So therefore, the individual has difficulty with their walking, and they have difficulty with the understanding perhaps the environment, or difficulty in terms of differentiating between a safe and an unsafe environment just because of their cognitive problems. So if the family is aware of these risk factors, that they can alert the nursing staff if they notice anything that's going awry with their loved ones. So in a sense, they become the eyes and the ears of the nursing home in terms of seeing things that need attention and hearing things perhaps from the resident themselves that needs attention. Now, on the other hand, if the individual falls are due for a reason. And it's important that the families hold the facility accountable for why the individual has fallen. Is it because they have an acute medical problem going on at that time? They have an underlying infection? Is it because they're taking too much medication? Was there a new medication added and the dosage might be too high? Or is this a chronic problem and the interventions put in place by the nursing facility are no longer working to prevent falls and they need to reevaluate their interventions? So all those things family members should ask the nursing facility to do.
So is there a type of plan that the nursing home facility normally would construct in order to kind of get on top of whether or not the person is going to be a high risk factor, and what they should do if they identify that person as a high risk factor?
Yeah, all facilities do have they do full risk assessments, and there are a variety of full risk assessments. I think the most important factors to assess is, does the individual have a past history of falls before coming into the facility? A past history of falls is the strongest indicator of future falls. The next are, does the person have a cognitive problem? Do they have difficulty with their mobility? That's gait and balance and transfers. And then urinary incontinence. Those are the four main risk factors for falls. Now, if you have those risk factors, what should be done? Well, the nurses should refer the resident to the doctors and other health professionals for evaluation in terms of, why do they have a cognitive problem? Is it due to dementia? Are they anxious? Do they have depression? Why do they have a problem with mobility? Is it because of their arthritis, their joints? Do they have diabetes that leads to problems with their balance? Do they have a minor stroke that has occurred and that affects their balance? And then urinary incontinence as well. And urinary incontinence or losing your urine is not a normal consequence of aging, but there's all sorts of reasons for it that are readily treatable as well. So once you have that evaluation, then you develop a care plan by the multidisciplinary team, the doctors, the nurses, the social workers, the therapists, nutritionists, et cetera, et cetera. And then you put that plan into motion. And then you monitor, are the interventions that we have put in place working? And if not, then we need to develop new interventions. Now, if the individual happens to fall during that time, it's important for the facility to look at, why did the fall occur? What were the symptoms prior to the fall? Were people dizzy? Were they losing their balance? What was the location of the fall? Was it in the bedroom? Was it in the bathroom, hallway, dining room? And what were they doing at the time of the fall? All those things will help the doctors determine what the cause of the fall is. And then you do another risk assessment to see, are there new risk factors available? And you start the whole fall prevention process again. And unfortunately, a lot of nursing facilities don't have this in place. They have the risk factors, full risk factor assessment, and then they have some generalized generic care plans put in place. But fall interventions to reduce the risk of fall have to be individualized.
Okay, so that's kind of scary that most nursing homes do not have, as just customary and normal practice, fall prevention plans or ways to really help these things to not happen. So if you're the family of someone in a nursing home, then what can you do to, short of going to the top of the company and complaining, but what can they do if that's the situation?
Well, you've asked a very good question, and it's a very difficult question to answer, that's for sure, because family members don't want to take on the power structure of nursing facilities, because then they're going to be fearful of retribution or something like that. What I have done in the past is that first of all, there are a number of physicians in this country who are known as geriatricians, either internal medicine doctors or family medicine doctors who have special training in geriatrics. And they're all over the country. And I think that what you can do is you can enlist one of these physicians as the primary care physician for your resident within the nursing home, and let the physician lead that charge or battle or questions against the nursing facility in terms of, have they done the proper risk assessment and the care plan, et cetera, et cetera.
Yeah, but primary care doctors probably don't want to get involved. But you're saying if you get like a geriatric doctor, then they're more well suited for that type of action.
Absolutely, because they're advocates for older people.
Got it. That's great.
And to actually to get a list of geriatricians is quite easy. All you have to do is to call your state medical board, and they'll provide a list of all the geriatricians in your area for you.
Now, you mentioned hip fractures. What are some other injuries that you're seeing when people are senior or elderly people are experiencing falls?
Well, in terms of the nursing facility, about 10% of falls will result in injury, significant injury. And significant injury are hip fractures, head injury, and then spinal cord trauma. And then about 30% of falls will result in minor injuries, muscle bruises, sprains, skin tears, those kinds of events. And the other interesting thing is about 30 or 40% of individuals who fall repeatedly, who have multiple falls, even without injury, will restrict their mobility over time. And if you restrict your mobility, your muscles get weaker and you'll have difficulty with walking, balance, transfers, etc. And one of the reasons that they restrict their activity because they fear additional falls. So they figure, geez, if I just sit down on my chair all day or I stay in bed all day, I'll be safe. So fear of falling can be a significant consequence. Yeah.
And that's the last thing you want, because you want your loved one to get out of bed and try to live their life as normally as they could, before they got into the nursing home. So.
Absolutely. And even if you do a little bit of walking down the hallway with the assist of a nursing assistant or with a walker and everything like that, it's better to move than not move.
Right. Do you find that the seniors or elderly patients, that some of them might have a series of falls, kind of where you said like bruises or scrapes, and that kind of adds up and eventually then that leads to a huge fall where there is a hip fracture or, God forbid, a brain injury or such?
Yeah, that could happen. Yeah. I don't know what the prevalence of something like that is, but what you can do. But I've had patients myself who have fallen a few times and they have bruising of the hip, and then a third fall and they have a significant hip fracture. So what you can develop is some occult fractures, and then after a while that leads to complete breaking of the bone. So that could happen.
Yeah. And getting back to the bathrooms, they have those hard floors. Is there anything that they can do? Is there any technology or any type of flooring that you're seeing nowadays that might be able to absorb a fall a little easier for the patient?
Yeah, for the bathroom, several companies put out floor products that you can install in the bathroom, and the products are that if you fall down, it's not a hard surface, but it has some absorption. It's very similar to with kids with playgrounds, that they have put this kind of absorptive padding flooring all around play surfaces, so when they fall, they don't injure themselves. So the same kind of flooring can be installed within bathrooms as well.
Got it. So basically, doctor, what you've told us has been really, really informative, and a lot of our listeners are either patients themselves or they're the families of these patients. So if you could give our listeners some action steps that they could take in general to help protect themselves or their loved ones from falling in a nursing home or an assisted living facility, maybe 2 or 3 tips that they can take with them, something that is actionable as far as prevention, what would you recommend?
Well, I think the most important, and this can go the whole span of community assisted living, nursing facility, et cetera, is that the most important thing to understand that falls are not a normal consequence of aging. It is not normal for people to fall. Yes, people can trip and slip and falls can occur. But if you have a lot of underlying health conditions, then it's imperative that you get your loved one to a physician, particularly a geriatrician, who can evaluate why the individual has fallen. And so they can look at the causes. Is it physical problems? Is it due to medications? Is it due to cognitive problems, et cetera? And then also that geriatrician will then prescribe certain exercises with the help of a physical therapist in terms of improving one's walking, improving one's balance, and also an occupational therapist who will go into the home and make modifications to support the individual's mobility.
Should they do that before they get admitted into the nursing home? Do you recommend that, or if they are in a nursing home and they fall?
It has to look at individual cases. First of all, nobody wants to go into a nursing home. That's for sure. And I think a lot of people are transferred from home to the nursing home before they need to be in a nursing home. So I would suggest that if people have difficulty with falls and mobility in the home, that they do an assessment of the home and the individual's condition. And can the person remain within their home? And even if they can't, is going from the home to an assisted living facility preferable to going into a skilled nursing facility? So again, all this has to be individualized. But I think the most important thing I can say is that people get hold of a geriatrician who is trained in these things, that, they do 1 or 2 years of extra training for all of this to help them.
That is really, really good information, and I thank you for that, Dr. Rein. Well, I have to tell you, this half hour has flown by. I really, really appreciate you coming on, Dr. Rein. Now, I mentioned in the introduction to this show, I mentioned that you're the CEO and president of Fall Prevent, and that you're involved in the community and helping the community or helping elderly in the community with fall prevention. What good things are you doing now as far as with Fall Prevent?
Well, I do have regular blogs that I do in terms of educating individuals in the community about falls, and also the nursing facility. And this is sort of a plug.
That's okay. That's part of coming on, is you get to plug whatever you want.
But there's a online educational course for nurses called Pedagogy. So it's pedagogy.com, and it's online. And I have about 25 different courses for nurses there that deal with fall-related aspects in terms of looking at the process, looking at certain diseases in relationship to falls, et cetera, et cetera. So that would help nursing facilities as well.
Okay. And if somebody who's listening has a parent in a nursing home and has concerns about falls, could they actually contact you individually to get a consult, or, is that possible?
Oh, absolutely. Just you have my email address. I don't know if you'll post it, but it's DRREIN. So it's Dr. Rein at Verizon.net.
Great. And that actually will be posted in our show notes. What about if they want to find you on social media? Do you have a social media presence?
I have a Twitter. It's at DRREIN2. Great.
Well, thanks again for coming on the podcast, Dr. Rein. We have got to have you back again because there's so many sub-issues having to do with fall prevention and assisted living facilities. And I'm going to want to talk to you about the environment in general and ways that in the environment that the senior and elderly population can be less at risk for a fall. And, that's something else that we definitely want to talk to you about. So that's it, folks. If you have any questions about an injury to a senior or elderly person, such as a fall in a nursing home or assisted living facility, or being tended to by home health care, please feel free to email me at info@injuredseniorhotline.com. That's info, I-N-F-O, at injuredseniorhotline.com. Our website is www.injuredseniorhotline.com for the National Injured Senior Law Center. If you like the content that we discussed today, and Dr. Rein gave us some really good information and strategies to deal with falls in assisted living facilities, just head over to our show notes where you'll find a summary of today's show and any important links we mentioned, including Dr. Rein's Twitter handle as well as his email address. Also, always feel free to reach out to me about your own story as an injured senior or elderly or disabled senior or elderly individual at info@injuredseniorhotline.com. Thanks again for listening to the show. Be sure to tune in for next week's show, and I will talk to you soon. Goodbye, everybody.
Thanks for listening to the Injured Senior Podcast with Steve H. Heisler. If you enjoyed the podcast, please rate, subscribe, review, and share on Apple, Google, or wherever you get your podcasts. To find out more or to get help anytime, go to injuredseniorhotline.com or call 855-622-6530. We'll see you next time.